Hey folks, Dr. Steve Garber here. Today I would like to talk to you about the foot and a common malady behind foot and other related pain known as pronation or hyperpronation, which is basically flat feet or excessively flat feet. Let's look at the anatomy of the foot. The foot is made up of 26 bones, 107 ligaments, and 19 muscles and tendons. And the function or role of the ligaments is to hold each bone one to the other and help to establish an appropriate arch. The arch is very important. It helps with shock absorption so that as we step, we get absorption of the forces coming down into the foot. But it also assists in the proper function of the foot so that when you step and you heel strike, then you're supposed to roll off the side of the foot and come off the ball of the foot. Well, there's a genetic disorder called ligament laxity that occurs in many individuals, and that's a softening or an excessive lengthening of the ligaments where the bones in the feet are no longer held properly together and they basically collapse, allowing the foot to turn inward and pronate or become flat. And that throws off the step and the shock absorption of the foot, creating foot problems and potentially knee problems, hip problems, and lower back problems due to what is known as the kinetic chain. And that is all the events that occur between all the joints of the lower extremity, the foot, the knee, the hip, and the pelvic structures of the lower back. They all must function in harmony with one another in order for all of them to function in a pain-free fashion. The feet are the true platform of the body. They're the first things to strike the earth when we stand. And if they are not balanced or functioning properly, then it will affect the foot itself and the knee, hip, and the lower back. Foot pronation or flat feet can occur as early as childhood and is often seen once a child begins to ambulate or walk, or it can occur later in life as a result of stress and pounding to the feet, and often occurs as an end result of pregnancy in women because of the release of a hormone called relaxin, which is designed to loosen the ligaments of the body so that the pelvic structure is open and the baby can easily come out. But it can have a negative effect on the feet and cause flat feet. At the Garber Chiropractic Center, we correct this through the use of custom foot orthotics. And here's a sample of one of them. This is the Vasili orthotic, and this can be heat molded and custom made particularly for your foot and to correct the imbalance within your foot. When the foot is in the orthotic, the arch is reestablished and the function of the foot properly returns, having a positive effect on the foot itself, the knee, the hip, and the lower back. Foot pronation is another common cause of plantar fasciitis, which is an inflammation of the soft tissues under the foot and is a very painful disorder. Characteristic of pain in the morning when you get out of bed, making it very difficult to walk, that eases as the day goes on and the tendon begins to relax. And this is a viable treatment for plantar fasciitis, along with other things that we would do, including foot adjustments, electrical muscle stimulation to the tissues of the foot, and the application of some deep, moist heat. So you're probably wondering, can I help your foot pain? Or can we correct the imbalance within the feet and maybe help your knee, hip, or lower back pain? Well, the only way to know is to come in for an appointment. So what I'd like you to do is call the number on the screen and set up a no-charge consultation where you and I can sit down together and discuss the nature of your foot problems and or knee, hip, and lower back problems and see if you can be helped through chiropractic care. So stop suffering, give us a call, and let's see if we can help you. Take care.